It's a great pleasure to welcome Luis da Silva, who's the CEO at Healthbridge, to What's Next. Hello, Luis. Welcome to you. Great to have you with us.
Thank you, Aki. Really great to be here with you.
No, it's great to have you. Luis, tell us a little bit about Healthbridge. Who is Healthbridge and what do you guys do?
So Healthbridge is a health IT company. We've been around for 26 years. And really what we try to do is facilitate the flow of information, healthcare information, between the different role players, be it doctor, medical aid, patient, to empower the right people to make the right decisions, the right clinical decisions, using technology and interfaces and so on. So we submit claims on behalf of doctors to medical aids. We have solutions, cloud solutions that allow practices to run their businesses. And we have a doctor's app, if you like, that gets rid of that yellow file and allows doctors to start treating patients with the digital support that the doctors need.
And of course, that's what the future is all about. So I'm looking forward to our discussion. Now, Healthbridge was, you were quite early actually to identify the importance of AI in healthcare when you partnered with Google 5 years ago, and it feels like it was yesterday. And tell us a little bit about how you identified AI as a future game changer all the way back then, 5 years ago. And how has this helped take your offerings to new heights at Healthbridge?
So, Aki, we were very fortunate. We are fortunate. Our founder and current chief innovation officer, a gent by the name of Harry van Zyl, was in one of the first classes in the early 90s to come out of MIT, having studied the theory of artificial intelligence. Of course, in those days, it was just a theory waiting for the computing power to one day arrive. And of course, nobody had any idea how big AI would become. And then just before COVID hit, we had to make a call on our new technology architecture. And with that in mind, understanding that AI was going to be a strategic consideration, we chose the Google platform at that time to following up. As a result, having somebody who in the business innately understands the theory and the potential of AI, together with a specific form that we created called the Innovation Lab, we've been able to leverage the vast data we have, and now, for now at least, be ahead of the curve in making AI truly beneficial to clinicians. And an example of that is in our Healthbridge Clinical, the doctor's app. We currently have about 9 AI touchpoints that seamlessly is woven into the patient-doctor experience when you go see a doctor. And excitingly and tangibly, 75% of doctors signing up to Healthbridge right now are ascribing that sign up because of our clinical app together with its AI features as the main reason.
Wow, that's very impressive, and I imagine that it's just growing day by day because it's really important for doctors to have that information at their fingertips, and especially as you look at this AI revolution and how it's just changing everything around us. Now, many other entities are rushing and really trying to integrate AI into their medical services. I think there's not one business in the world that isn't adopting AI as a strategic game changer going forward. But Healthbridge really stands apart for its approach to AI. You know, you've understood this, as you mentioned, your founder in the 90s really had a grasp of where AI is going to be today. It's idea of AI with purpose, right? And I'd like for you to unpack this for us and tell us what is idea of AI with purpose mean?
Yeah, I think I want to start with a heartening comment, and we're getting a number of these coming out almost on a weekly basis now from a doctor client of ours that said, the innovative AI in Healthbridge Clinical has changed my life. I've freed at least 45 minutes worth of admin time. With the pathology results reader, my notes are being exceptionally scribed with clinical grade notes, which gives me the opportunity to consult my patients and focus on them during the consultation. And that to us really summarizes AI with purpose. Our own purpose reads to liberate life through transforming healthcare. And AI, it's almost, be careful of the wish, as you say, as it comes. And importantly, doctors don't want apps for app's sake, and they certainly don't want AI for AI's sake. In fact, in the past, tech has added friction to doctors' lives with too many keystrokes and clickety clicks and so on and so forth. And so ultimately, AI with purpose means that it makes healthcare more affordable, more accessible, and with better clinical outcomes. And importantly, it also has to bring back the joy and the balance into doctors' lives, which is something that has been, Aki, slipping away over the last couple of years. The reality is that doctors are becoming more burnt out. They're becoming more and more, they're considering leaving the profession. And at the same time, we are faced with being 6,000 doctors short in our country. So for us, it's a bit like purpose with a capital P. It's a country necessity, in fact.
Did you say that your new technology is able to transcribe what doctors write? So it's able to distinguish their handwriting. Did I get that right?
It's ambient listening. So with the consent of the patient, the doctor doesn't write on a paper, doesn't type, has a discussion with the patient, moves around, checks the blood pressure, the heart, the lungs, and so on and so forth. The
Okay.
ambient listening, the AI listens into the conversation and immediately creates clinical grade notes. There's a format. There's many formats. One is known as SOAP
Yes,
that
yes.
doctors do. Subjective,
Okay.
objective, assessment, and then the plan to treat the patient. And the AI will listen to the conversation, neatly summarize that conversation clinically in that format for the doctor
Okay.
ultimately to confirm, and that then gets added to the timeline of that patient's for history's sake, and for AI to read later
Okay.
to make other assessments.
Yeah, I was going to say any technology that can decipher what doctors write on their pad when they give you a prescription. I think there's no technology that has been developed to do that just yet. I think it's only pharmacists understand that language. But just tongue in cheek there. But listen, it's a lot of concern has been raised about the idea of AI replacing healthcare jobs. We hear it over and over. I mean, it's not just healthcare, but it's every single industry. And I think that people misunderstand the concept of AI. I mean, my view is that AI is there to augment our technology, to make us superhumans and help us do things better. But could you tell us about Healthbridge's philosophy on this topic?
Yeah. So, Aki, maybe let me start with a personal story. I have a gem in Gemini, like a GPT in ChatGPT, that is titled My Strategy Assistant. I have another one that's called My Health Assistant. They are my two best buddies. And I can tell you, we've just been through a strategic review of the whole company. Never have we done it with such quality and such speed. And importantly, now it's helping us not just to define the strategy, but how to go about executing the strategy. So that's on a personal note. I'm not feeling threatened as CEO. I'm feeling amplified. And that's our belief in AI. We don't believe it'll replace doctors, but it will and already is amplifying them. Every single feature that we use AI for is really a co-pilot for the doctor. It never acts, makes a decision, or even messages a patient without the doctor first reviewing and making the final call. And Aki, also a big factor in healthcare is the human connection, the feeling of being cared for. I still remember as a kid, my grandmother, she would go see our family doctor. She'd catch 2 or 3 buses from Primrose into Germiston, sick, feeling bad. And she'd walk out of Dr. Blake's office already feeling like she could do cartwheels. And that was because Dr. Blake was attentive and compassionate. So what we're seeing is AI is freeing up doctors to be more present with their patients, aided by this sheer processing power and context that AI has to offer to amplify them, and giving them balance back in life.
Mm, mm.
That's our philosophy, and that's
Yeah,
what we.
it's fantastic, and it's really empowering doctors, to make better decisions. And really, I couldn't agree with you more on your sentiments there. But I was just thinking about this now. When you look at your company, and I mean the healthcare sector, software as a service solutions like those offered by yourselves at Healthbridge, they're now at a crossroads. So for organizations like yourselves, you're effectively facing your own disruption if you think about it. How are you guys evolving and adapting accordingly to this?
Okay, you're so right. This is a question I go out on for long runs to contemplate over by myself. What we are seeing is that these native AI vertical or rather horizontal platforms like these LLM providers are quickly picking up the context of verticals like healthcare like a SaaS such as ourselves. And because of their scale, they can offer solutions at a fraction of the costs compared to that of conventional SaaS players. Of course, these horizontal platforms need access to data for training and context, and they also need the trust of the users. A further consideration is that no code is here. Today already, doctors could vibe code their own apps, customized to their needs. I mean, actually, we're seeing 10-year-olds doing it at the moment. So where does this leave SaaS companies like Healthbridge? And to be honest, I don't know. But what I do know is that we need to continue to earn the trust of our doctor clients, and we need to continue to disrupt ourselves proactively. Aki, Healthbridge has turned 26 last month, October. Started October 99. And over this time, we've had to reinvent ourselves 3 times. This is only going to speed up. And so ultimately, I think what is needed for any company these days, I would argue, is a culture of curiosity, adaptability, speed of value to clients, and importantly, with empathy. I think empathy is going to be a big factor. And so we just need to bet ourselves that we can be adaptable and be close to our clients and leverage these technologies and embrace the fact that we will look very different in 3 years from now.
No, you did right. And I think that's exactly the approach to take. One needs to be positive, proactive, and just embrace change. I think it's good to embrace change, and I think change is good for all of us. It just makes us better at the end of the day. Now, one of the ways you guys are differentiating yourselves is with your innovation lab, which sounds absolutely fascinating. Can you unpack this for us? What is your innovation lab and your efficiency lab that you have as well? And you've also got something called the I lab and the E lab. So fancy words, but what happens in each of these teams and why are they important to you?
Yes, so the innovation lab is named the I lab, and the efficiency lab is named the E lab. It's a big bet we made and are making, and thank goodness we did. Otherwise, we wouldn't have these features we just spoke about. The decision was off the basis of a great book called The Invincible Company, which is a derivative of the lean business model movement that's been going on for a number of years. And in essence, what it says is that there are 3 types of innovation: transformative, incremental, and efficiency innovation. And the iLab is a standalone team that focuses on that transformative innovation, like those AI features. And the reason for the separation is that it needs a separate budget, different types of success metrics, a dedicated team, and okay, even a different culture and governance, if it is to both survive and thrive alongside the momentum of the current business, because they'll always suck up the resources and their priorities. A key success metric, for example, is how many times did the team fail? How quickly did they fail? And importantly, what are the learnings that are encased in our AI tools for future experiments that we want to do? At the same time, a very formal governance process is needed. This is not a place where guys come and sit in beanbags and dream up cool ideas. So it's got its own board that reports like a REMCOM directly to the main board, that ensures that, one, the long-term ROI is achieved, and importantly, that pet projects and biases are dispassionately terminated and very quickly. In fact, one of the board members is from one of our investors that's a private equity company. And if it's not working, you cut it and you move on, just like you would do in an early investment of a business, for example. So what we've now done is started to fire up the E-Lab, the efficiencies lab, which is going to be a dedicated team to focus on internal efficiency innovation along the same principles and leveraging from the learnings of the iLab. Because while we are doing cool things for our clients, we need to completely change our own internal ways of work if we are to survive and thrive in this new world. But the principles are the same. Quick experiments, learn, fail, move on, and get going with traction.
Wow, it's a very smart move, that because I guess that you really identify very quickly what's going to work, what's not going to work, and it's brilliant because you are creating things that you otherwise wouldn't have created, and also innovating into the future. And this comes to my next point, because many AI practitioners are asking people to take the leap of faith. They're investing huge money in AI. But Healthbridge is doing something different. You're showing that there are tangible, proven results, and it's quantifiable what you're doing. Could you provide some examples of this and why this is a better approach?
Yeah. So Aki, we are shaped by our clients. Doctors are tough customers, and for good reasons. They've been trained to provide evidence-based medicine. That's how they're wired. And so anything you bring them has to have evidence, just like they make their decisions based on evidence on a daily basis medically. So in everything we offer, we have to prove tangible either cost savings and or tangible additional legitimate revenue for our clients as a result of our solutions. So it's all about proving and ensuring that there's either time saved or additional legitimate revenue. So let me give you some examples. The first thing, maybe not so well known by the person on the road, is that there are enormous coding complexities when a bill is put together for a procedure, an operation, and so on, particularly for specialists. Not only are the codes complex, but even the incorrect ordering of the coding we saw was resulting in anesthetists, for example, earning 18% less than what they should have legitimately been earning because the coding wasn't correct and in the right order. And in this case, machine learning was instrumental to fix this. Again, it's patterns, it's recognition, so on and so forth. Another example is the complexity of prescribing with the right meds. There are over 40,000 meds to choose from. So here, our AI takes into account not just the diagnosis that the doctor has summarized to, but also the patient's demographics like age and weight. Is it a syrup? Is it a tablet? The medical aid formulary. Medical aids will pay for certain meds, and for others, the patient will have to pay a copay or a levy. There could be contraindications with current medications that need to be factored in at a very, almost like at a chemical level. And so these things are all taken into consideration, and a short list of meds are suggested to the doctors amongst those 40,000 options that can be kind of a cognitive overload. And lastly, the time, doctors' time that they could be using either to see more patients or otherwise, frankly, to focus on themselves or their families, take the kids to soccer or swimming or something. And so, as I mentioned earlier, these new AI features, consistently doctors are telling us it is saving them clinical admin of between 45 minutes and 60 minutes a day. So those are tangible, proven savings, both in terms of legitimate revenue and in terms of time given back to doctors.
That's a significant, and I imagine that in time, as the technology gets better and better, this could possibly even increase. And when you look at one of the big challenges you touched on, and time, I believe it's, I keep telling people, your time is valuable, your time is money. Make the best of your time every day. And one of the biggest challenges in the healthcare sector is that the idea that the medical practitioners are being paid for quantity of services rather than the quality of services. So, and I guess that could be reinforcing wrong behaviors. How do you envision the sector shifting from, to a value-based care model compared to where it is today?
It's a great question, Aki, and we are very passionate about this. I mean, you're on the money. The challenge here is that there are misaligned incentives. Not consciously, I would say, acted on by doctors, but they are there. Doctors are paid per consult or per operation. The quicker they do this, the more time there is to see more patients and make revenue. Conversely, if they spend more time attentively with the patient, they don't necessarily get paid for that compared to that of a short consult. So it's really you're on a treadmill. And moreover, if the patient doesn't get better, well, then they'll come back and there's another consult and another charge. So this is the incentives alignment problem. What value-based care is premised on is paying healthcare professionals for outcomes and ultimately for keeping the community they serve healthy. There are a lot of downstream costs, especially when things go really wrong and patients land up in hospitalization, that if avoided can be saved, and the value thereof can be shared with doctors if patients are treated effectively and are kept healthy. In fact, actuarial models are already showing that doctors stand to earn more than they currently are. The challenge is how do you get everyone, and I would say Healthbridge included, to stop trying to protect their piece of the healthcare pie, but rather to work together to make a newer, bigger pie. It's a complete change of mind shift and industry structure. And then, of course, there's the issue of patient engagement and compliance. Doctors rightly say, look, you want to hold me accountable for my patient's health. But if my patient isn't bought in and isn't engaged and isn't going to comply with the treatment plan, how can I be held accountable? So it's a complex problem to solve, even though it's got so much potential. There's a big debate about what is value, especially to the patient, who should be at the center of healthcare. Is value the fact that the diabetics HbA1c marker has gone down by 1 point, or rather that they have energy to be productive with greater quality of life? And how do you measure that with some level of objectivity? It's a really complex problem. These challenges need to be addressed, and we, at least for starting, are starting to build the building blocks. One, data has to be shared. Data used to be in the silo of the yellow paper files. Now they're in digital silos between different doctors, and typically teams of doctors need to collaborate together to work on a patient that is complex. And secondly, patient engagement tools that are actually, we're using behavior design theory, will get doctors to be more proactive and engaged in their own health. So there are very different pieces that need to come together. The technology, I believe, is here. It's really how we align incentives from both the medical aid or insurer, the doctor, and the patient. That is needed.
Yeah, makes complete sense. And lastly, Louis, I'm not sure how to put this question to you, but how do we ensure that the right talent and resources are streaming into the healthcare sector? I guess it's like any sector, but you want to get the right people, you want to get the right resources. How do we ensure that this happens?
That's the other thing that keeps me thinking when I go on my long runs, Aki. We're in a global talent war. Any bright tech can these days work from their home, even their bedroom, and earn US dollars. That's the reality. And so first and foremost, as an executive, our job is to ensure that the business grows. A growing business creates new opportunities for its top performing employees and can compete in salary to attract the best. So that's the first thing that needs to be in place. Secondly is culture, a culture that is purposeful, dynamic, where it welcomes diversity, but off a foundation of common values. That is key. And lastly, we've strategically chosen to be a platform, not a closed play. We don't have any dreams that we can, on the tip of Africa, innovate everything ourselves as much as we have the iLabs and the eLabs and everything. We want to encourage an ecosystem of innovation together with other entrepreneurs and startups to collectively add more value to the clients in the industry that we serve. And that's how we've architected our solution, in fact. So as an example, that AI-powered ambient listening we spoke about earlier, that is a partnership with a company called Nora AI. These were two students that, as a side hustle, used AI to create summary notes and sell them to fellow varsity notes, absorbing notes, PDFs, online lecture recordings, and so on and so forth, and would create summary notes for their buds to go and write the exams. Really entrepreneurial, leveraging the technology. We came across them and we took their underlying technology and we pivoted that by adding some healthcare context with a bit of seed money from us. And ultimately, that became the building blocks of what is now our ambient listening that doctors are using during consults. There's a few other partnerships like that we have in our ecosystem, but we certainly hope to add more, really to live to the principle of a platform with an ecosystem of co-innovators at the end of the day.
Well, it's super exciting stuff, Louis, and thank you for sharing those insights with us about where you're going with Healthbridge and what the model is all about. And the healthcare industry needs these kinds of innovations. So thank you for sharing them with us. Luis da Silva, the CEO at Healthbridge. Thank you for your time, sir.
Thank you, Aki.